Hey, it's Jordan. I'm delighted to be joined by Carl Russell Slater. He is a council delegate for the Navajo Nation, and I'll let you describe all the communities you represent. I definitely wanted to have a Navajo leader because coronavirus has been really affecting and unfortunately taking lives on the vast reservation. Can you just tell my audience which communities you represent?
Definitely. Um, good morning, Jordan, and thank you for shedding a light on the situation on the Navajo Nation. If you have any Navajo followers, Carl Russell Slater Dasha Jine, Ki Ani Nishlan Sontane Bashish Chi and Sina Jenny Dasha Chair, Sontane Dasha Nalit Nakana Dant Nasha. My name's Carl Russell Slater. I'm Kia Ani, born for the Jewish people, and I am a council delegate, which is one of 24 in the legislative body of the Navajo Nation, which is the governing body of the Navajo Nation Council. I'm the vice chair of the Health Education Human Services Committee, and I represent 5 chapters out of 110 on the Navajo Nation. Those 5 chapters are Chija, Rough Rock, Rock Point, Round Rock, Lukachukai, Saley, wheat fields. And we have confirmed cases in our communities, and we actually had the first confirmed Indian Health Service fatality from COVID-19 was a constituent of mine and resident of one of our communities. So the Navajo Nation is 27,000 square miles or greater than that, and it's about the size of West Virginia. It's a little bit larger than that state. On a per capita basis, we're only behind New York and New Jersey in terms of our infection rate. We have, I believe, 13,427 COVID-19 tests that have been administered. And within that, there's been 2,307 confirmed cases, which from yesterday was an increase of 166 new positive cases. So we have a very high rate of infection right here in Navajo. And sadly, our total fatalities have increased to 73 as of yesterday.
And obviously making matters more difficult is, I believe, maybe the number is different now, but about 25 to 30% of homes don't have running water.
Yeah, that figure is tough to get a pure, accurate count of at any given snapshot when you're looking at it. Sometimes official reports will say it's as low as 12%, but in general, when we're pulling these numbers, we say about 40% of households don't have running water and electricity. So when it comes to performing the important sanitation procedures that are a part of CDC guidelines and Navajo Nation public health orders, many households, and in my community, I have two chapters that rely a lot on hauling water for domestic water use. And just to give you a little snapshot of how COVID can affect ordinary government operations, people will go and haul domestic water in the back of their trucks from these chapters, from these local units of government. And the chapters had to close down before they could put protocols in place to haul water safely. And that means having appropriate PPEs, sanitizers, gloves, all of that. So we had community members who were without really water for about 2 weeks. And then you add in these public health emergency orders that have closed down the nation for 57 hours over the weekend. I think this is our 3rd one that we're entering or we're in the middle of, and the nation's on lockdown. So you are not allowed to travel unless you are an essential worker performing your official capacities, or there are certain exemptions for ranchers. So, you know, if you're a rancher and you need to go water your cows, you can do something like that. Mm-hmm. But it's it's impacting every aspect of life out here, and the circumstances that existed prior to the outbreak of COVID have exacerbated the outbreak in many instances.
And let me ask you, because like in other reservations, Cheyenne River, Standing Rock Sioux, several others I've spoken to, there's obviously a lack of hospitals. And the closest hospitals are sometimes, 100 miles away. What is the picture like between the reservation, which is parts of Utah, New Mexico, Arizona? Are there enough hospitals? Are there enough beds? I believe there's not a huge number of ventilators.
So that was the biggest concern to me as an elected leader after reading, I think it was the Imperial College report that came out back in March. And it helped conceptualize how the overwhelming of the healthcare system actually is maybe the most important concern for us out here on Navajo, and why we might have to take steps that are more drastic than areas that are better resourced. The Navajo Nation has about 12 or 13 hospitals and clinics. Again, that may seem like a lot when you consider a population of 180,000, but then it's spread out over 27,000 square miles. The resources that are available in those facilities are actually quite limited. The Indian Health Service as a whole, I think this past year was funded at a little over $6 billion. So that's for the entire United States to serve all American Indian and Alaska Native peoples. But when you talk to tribes and you do an analysis with medical and public health professionals, as many tribal leaders do in order to advocate for more funding in Congress, the need is closer to 38 billion, if not $50 billion. So the staffing levels are lower. There's chronic issues with having a good number of doctors and nurses, or appropriate number just in general. And so the Navajo Nation, through the Health Command Operations Center and IHS working together, have been recruiting more doctors to come in, either with the coordination of FEMA or relief groups. And those have been deployed to different units that have seen either infections of their staff to replace infected members, or to supplement lower numbers that already existed. Mm-hmm. My 5 communities are primarily served by the Chinle Service Unit of the Indian Health Service. So on Navajo, we have another, I'd say, extenuating circumstance related to COVID. We have tribal organizations that contract with the federal government with the permission of the tribe to perform healthcare services. So that's Tuba City Healthcare Corporation, that's Winslow Indian Healthcare Corporation, that's Sehotso Medical Center. There's also Sage Memorial, which is another private hospital that receives 638 funds. Those are not under the direct administration of IHS. And then, for example, that Chinle Service Unit, the facilities that are in that service unit, which is like a geographical area in central Navajo, they are under the direct administration of IHS. So the nation has to take the lead in coordinating the collection of data, resourcing IHS and non-IHS facilities, and ensuring that there are appropriate amount of ventilators or respiratory unit beds or ICU beds. That service unit is at level 5 of its surge plan. It entered that this past week. I think that they're going to start closing down outpatient services and focusing purely on COVID and like emergency services. So they've reached the top end of their capacity essentially in order to take care of COVID and, pardon me, take care of their ordinary responsibilities. In terms of ventilators, I think we're up to 51. It's something that was a request right from the outset. It's very difficult to get consistent information when you have all of these different entities that you need to manage as a nation. And there are certain areas in Indian country where you have compacted and contracted all of the services with IHS into either like a master contract or pooled all the funding together. And it's something that we were looking at as a nation and doing before this all broke out, but there's no commitment there. It's just something that highlights when you have a fully integrated healthcare system, it's probably easier to manage a pandemic. But hindsight is 2020, because there's a lot of positive benefits from individual organizations taking on the delivery of healthcare that are run by tribal citizens with the partnership of the tribe. So,
right, and you're also dealing with the basically Navajo members have kind of more vulnerabilities than a lot of other people would have, chronic health issues like diabetes, heart disease, obesity, that the people on the reservation already have, particularly elderly people. So it makes your community even more vulnerable to such a deadly disease.
Yes. The Navajo Nation population as a whole has many more underlying conditions that make them more vulnerable to the coronavirus. So that's increased rates of diabetes. And we actually haven't seen a decrease in Navajo. I think in the past couple of years, I think we saw an increase of 1% in the diabetes rate. I think it was from 17 to 18, which was the last available data. The concern is that if you have a sick population or a population that has a lot of underlying conditions, you add in then a lot of elders who are our traditional knowledge keepers, the backbones of our communities, and like the pillars of our families and our clans, that you have a recipe for disaster in terms of perpetuating traditional knowledge and not fragmenting our family units. A lot of Navajo families live in multi-generational homes. So when it comes to adhering to public health orders saying that, if you say you were potentially exposed to someone, but you don't know if you are going to be symptomatic in the next few days or not, so it's important to go and self-quarantine. Many households don't have the ability for family members who may need to quarantine to actually do that. So one of the initiatives from the nation has been developing these like level 1 care sites or alternative care sites. And one of them is being set up in Chinle and hopefully will be operational, I think, in this next week. One just opened up in Shiprock, and I think there's one open in the Gallup area now. But the idea behind the site is that, say you have 50 beds, you're able to isolate people from their families, their multi-generational homes, put them in this unit where it's people who are, lightly symptomatic or asymptomatic but have tested positive. They can receive that lower level of care and then hopefully resolve themselves and return back to their homes without increasing the spread. And a part of that is material reasons. The nation has a very low good housing stock. It's a consistent issue. Depending on the figures, the Navajo Nation, unemployment rate is 40 to over 50%. We are, I'd say, I don't like to think of us as like poor in the big picture with all of the concerns you should have in your life, but financially, fiscally, we're a poor people, and having lots of rooms and homes and running water and all of these things, many of our households don't have them, and it just exacerbates the issue. But what makes us rich is our culture, our tradition, our language, and that's held by our elders. And we need to do everything that we can in our power to protect them. So on this past Thursday, we have a committee of the whole that meets on the council. We met telephonically. And I posed the question, at what point do we need to prioritize our elders or our hatathlis or our medicine people, their presence in these alternative care site facilities, or segregating them from their homes to potentially mitigate their exposure and death? Because that's been my primary concern from the outset, is preservation of life and protecting our traditional knowledge, language, cultures, traditions.
And the federal government broader earmarked $8 billion to go to tribes. Reporting recently is virtually nothing of that $8 billion have gone to tribes as part of the multiple bailout packages. Can you kind of talk about outside of healthcare, what kind of relief have you gotten from the Trump administration, if any?
So there was $8 billion that was set aside for tribal governments, and it became unnecessarily a sticky and thorny issue for no reason other than someone, or I don't know what to say, but I mean, I publicly asked on, it was either on Twitter or Facebook after it broke, that Tara Sweeney should resign. And she's the Assistant Secretary for Indian Affairs, who was supporting the inclusion of Alaska Native corporations into the definition of tribal government for the purposes of distributing that $8 billion. Mm-hmm. Now, Alaska Native corporations are not tribal governments. They have an entirely separate history. There are, I think, over 220 Alaska Native villages that are federally recognized tribes and are listed by the Bureau of Indian Affairs of the Department of Interior and the Federal Register as being a federally recognized Indian tribe or Alaska Native village or pueblo or rancheria. So they, in many cases, are multi-billion-dollar corporations. They're all for-profit, and they do not provide other services to Alaska Native peoples or Indian peoples in the lower 48 like a tribal government does. And they don't have like a democratically elected council or a council based off of traditional precepts that govern them. So when you include these multi-billion-dollar corporations, there is the potential for them to take over half of that $8 billion that's set aside for Indian country. As I mentioned, there's 574, I believe, at this time, federally recognized tribes. These tribes have the obligations, just like any other sovereign, to provide for their people, whether it's healthcare, education, public safety, and based off of the political relationship with the United States actually has a strong interest in supporting those functions being delivered by these tribal governments. So just as states, counties received relief, tribal governments are obligated, I'd say, before them to receive relief based off of treaty obligations in addition to, the U.S. Constitution. But that $8 billion has not been distributed yet because a group of tribes, including the Navajo Nation, sued the U.S. Treasury saying that that was not the intent of Congress. And when you go in and you talk to our legislators, the people who put together this provision, there was no intention to include Alaska Native corporations. But Tara Sweeney is a former lobbyist for, I think it's Arctic Slope Regional Development Corporation. And I don't have their figures in front of me. I don't want to misquote them, but I mean, they are a multi-billion-dollar corporation, and that has, I think, double-digit billion-dollar revenue every year. That said, I think it's a slap in the face to the tribal governments when you include for-profit entities in that distribution formula.
Well, I'm sure those for-profit entities donate to politicians that are making these decisions as well.
They have a very healthy presence in DC to advocate on behalf of their interests.
Yep.
Yes. So, the Navajo Nation, because of the importance of the relationship with the federal government in providing resources to the tribe and policy that affects Indian country and the Navajo Nation, has an office in Washington, D.C., and they've been working tirelessly to to educate members of Congress and put pressure on Treasury to distribute the funds solely to Indian country, solely to tribal governments. So I guess just as a point of fact, the Navajo Nation fiscal year starts in the beginning of October, and we passed a budget this past year that was a little over $1 billion. But of that, there was only $167 or $170 million general funds, like discretionary budget. So the rest are made up, the rest of that funding, that over $1 billion, is external grants, primarily from the federal government. So we have a very limited, very, very limited amount of money to distribute and pay for services and needs or capital projects with funding that is just completely indigenous to the nation, collected through tax revenues or other mechanisms, royalties. When it's only a little over a tenth, right? Or maybe 20% of our overall budget. So this funding was incredibly important to supplement the decline in revenue that we've seen and will surely see, and to ensure that those essential services that I mentioned earlier, like water hauling, trash disposal, things that need to happen at the chapter level or in the community level, because there isn't a trash route. There isn't running water to your home. You have to go to the chapter to get rid of your trash if you're lucky, or you have to go to someone else's chapter, or you're like a lot of people and you just burn it. These essential services require funding in order to continue on, and that's paying for PPEs, that's paying for sanitation, that's all of that. It's also keeping people employed so that they can continue to telework. There is limited internet data connectivity on the Navajo Nation, but we're looking to expand hotspots for students. Nick College and Navajo Technical University are the two primary, or they're the two institutions of higher learning on the Navajo Nation that are chartered through the Navajo Nation. And they are looking at using the 2.5 gigahertz spectrum and working with some companies to build out some infrastructure for their students to come to a local hotspot. So if you don't have internet at home, maybe you drive to the chapter, you drive to a library or something like that, and then you're able to use the internet to continue your classwork. There's just a myriad of issues, and we need a lot more material support in order to confront this.
Hope you enjoyed that last video. Hop on over to statuscoup.com, where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.